Dangerous blood pressure medication side effects, tips for better blood pressure. Today, let's delve into the pharmaceutical industry's top choices. Similar to cholesterol-lowering medications, blood pressure drugs are commonly prescribed globally with notable side effects. High blood pressure, known as the silent killer, silently deteriorates health. As time passes, it can become active, leading to heart attacks, strokes, heart failure, vascular diseases, as well as kidney and eye problems. Statistically speaking, it's common for blood pressure to rise by 20 to 30 millimeters a merch from age 40 to 70. This period is when the consequences of your lifestyle choices from previous years or even decades become apparent. In the upcoming video, we will delve into the primary reason behind high blood pressure and provide strategies to prevent it. Additionally, we will explore ways to reduce reliance on blood pressure medication for individuals who are already on it. Many people get incredibly frustrated when their doctor tells them they need to start taking blood pressure medication, and many wish they could stop taking it immediately. The good news is you can actually do a lot yourself if you have high blood pressure to potentially stop taking your medication or reduce the dosage. The bad news is you should never do this on your own just because you read an article, a blog post, or watched a video from some influencer. You really need some guidance from your doctor. We'll look at why in a moment. And before we discuss the top cause of high blood pressure, let's remind ourselves of the importance of maintaining a normal blood pressure. High blood pressure stands as the foremost risk factor for cardiovascular diseases, the leading cause of deaths worldwide. It is essential to target a blood pressure reading of 120/80. For individuals with hypertension, the goal should be to lower it below 140/90 using suitable therapies. This reduction can slash the risk of heart attack or stroke by 50%. An estimated 20 to 30 million German residents fall short of the ideal 120/80 blood pressure level, with approximately 30% or one-third unaware of their high blood pressure status. That means check your blood pressure from time to time, measure your blood pressure because it is incredibly important to start therapy as early as possible. About 88% of those affected stick to their therapy and achieve very, very good blood pressure values through it. And what do these numbers tell us? With hardly any other disease do people voluntarily get treated as well as with high blood pressure. Apparently, it really is the case that symptoms like headaches or a red face and so on, stress feelings, are significantly reduced. And what you can do to maybe reduce your blood pressure medication, or we'll clarify how to use them much more effectively in a moment. Let's dive into the top 2 causes of high blood pressure. The number 1 cause is obesity. Experts estimate that about 30 to 60% of hypertension patients have obesity as the underlying cause. And in severely obese individuals, high blood pressure occurs 3 times more often than in those of normal weight. And now the question is, what is the connection between obesity and high blood pressure? First of all, more weight means the heart has to work harder. And then, with obesity, we also have this silent inflammation of the blood vessels, which can also contribute to high blood pressure. And then something else interesting happens. With obesity, the hormones aldosterone and cortisol are released in greater amounts, which also drives up blood pressure. And what else happens? Something incredibly fascinating happens in the brain. A diet that's too high in calories increases the density of blood vessels. In the hypothalamus, this brain region produces important hormones that also help regulate blood pressure. And here we have the hormone leptin. Leptin controls our appetite. And this messenger substance is then absorbed or produced by fat cells. Certain brain cells called astrocytes are activated by these leptin concentrations. These cells then release a growth factor. This growth factor causes the vessels in the hypothalamus to grow, essentially creating new vessels there, which leads to high blood pressure. This disrupts blood pressure regulation. The question is belly fat dangerous? Of course, many hormones are produced there. That means we should try to get rid of our dangerous belly fat. This brings us to the second top reason, which is lack of exercise. Lack of exercise causes high blood pressure. Why? Sitting for long periods makes you sick. The elasticity of blood vessels is reduced, and that causes high blood pressure. And if you have to sit a lot for work, then you have a much, much higher risk of developing high blood pressure and cardiovascular diseases. And now comes a very, very interesting connection. Canadian scientists have found that if you sit for about 8 hours in your free time, your risk of stroke increases significantly. This affects people under 60. In other words, people under 60 who sit for at least 8 hours in their free time have a higher risk of suffering a stroke within 15 years. Interestingly, this does not apply to the age group over 60, so this connection could not be established for those over 60. Why is still being researched? And the big question is, as I hinted at earlier, when should we start lowering blood pressure? In the past, it was always said that 100 plus your age was completely normal. And you can look worldwide, the professional societies recommend lowering blood pressure to below 140 over 90. And I can already hear the objections in the comments. In the past, we had this formula, and then many people write, yes, the pharmaceutical industry wants us to consume the medications. Yes, of course, the pharmaceutical industry wants us to buy the medications, just like the candy industry wants us to eat sweets and the travel industry wants us to go on trips, but you can check with any medical society worldwide. Blood pressure medications are not the top recommendation. Instead, it always states that treatment can and should initially be done without medications. Everything should be done to lower blood pressure naturally. It's really in every brochure worldwide. That means a fundamentally healthy lifestyle extends life expectancy by an average of 9 years. But there are two other components to the story. First, the doctor, because in our system you immediately get the info from your doctor to exercise more, lose weight, and take your blood pressure pills. Is that how we often inform our patients? Do we inform our patients super well? I don't think so, because really good education simply takes a lot of time. General practitioners don't have that time, and reaching for the prescription pad is much simpler. On the other hand, we doctors often have to reach for the prescription immediately because we need to protect our patients. If someone comes into the practice with a blood pressure of 160 or 170, it can very quickly lead to a stroke. My father tried it once. He suffered from high blood pressure, ran out of his medication, and then tried to manage it on his own. The result was a severe stroke, and he had to spend weeks relearning the simplest things like walking and grasping. So it's better not to try that. And secondly, we obviously have the patient as the second component, as you just heard. And what do we recommend to the patient? What are the 5 things every high blood pressure patient should internalize? First, of course, weight loss. Second, reduce salt intake. Third, immediately quitting smoking. Fourth, largely avoiding alcohol. And fifth, exercise and endurance sports. But most patients either can't implement these properly anymore or don't want to fully commit to them. They need to fully commit for it to work. Or they simply don't know how to implement these changes for themselves, even though these lifestyle improvements can be very, very effective. That's why many people just have to take blood pressure lowering medications to reach their target blood pressure range. So when do I need a blood pressure medication? If I, as a doctor, see that the patient is in danger, then I have to prescribe a blood pressure medication. It can be life-saving. We simply gain the time we need to work on the other points. And many people already fail at the first point of weight loss. Let's talk about the successes. Losing 5 kilos of body weight lowers blood pressure by 5 mmHg. And if you try Buchinger fasting, I was a fasting doctor for 4 years, you'll see much, much better results with fasting and lowering blood pressure. Use fresh foods, lots of salad, lots of vegetables, plenty of fiber, good oils, use olive oil, flaxseed oil, avoid bad fats, hydrogenated fats, trans fats, fried foods, and so on. Sugar needs to go too, along with ready-made meals, snacks, and so on. All of that needs to be eliminated. And any weight loss should happen gradually so that the body can adjust. You should favor a diet. specifically the Mediterranean cuisine. Lots of fresh fruit, lots of fresh vegetables, fiber, whole grains, legumes, fish, plant oils, and also plenty of nuts. And I've provided a download for you, a week of Mediterranean diet. You can download a free meal plan here under this video. A list of what's good and what's bad, so you can get a feel for this Mediterranean way of thinking. And back in the 1950s, there was a major study or several major studies, and they identified this Mediterranean diet as the healthiest, yielding the best results. And it's been that way since the 1950s and 60s. No other diet is more beneficial than this Mediterranean diet. As mentioned, the download is free under the video, and then of course you should avoid salt. 5 to 6 g per day is recommended and no more. You can replace table salt with herbs. Why? A high salt content in food promotes high blood pressure. And in ready-made meals, snacks, sausages, there's a lot of salt, even in bread, for example. So really make sure to cut down on salt. And whenever you feel like adding salt, you can find good salt substitutes. Quite tasty. There are already some very good products. What you should also do immediately is stop smoking, cut out nicotine. I know this is a big challenge for some people, but if you already suffer from high blood pressure, that's definitely the time to quit smoking. Just like giving up alcohol. The latest research shows to consume as little alcohol as possible. Even that once recommended glass of red wine is now highly questionable. And then we come to the huge topic of exercise and endurance sports. And here too there are hurdles and obstacles, and I'll show you how to best overcome them. Is exercise worth it for us? Yes. Exercise lowers blood pressure even in older age. Regular physical activity can improve blood pressure by up to 10 mmHg, and that's a very, very good result. It's comparable to the results of medications. Let that sink in. And before we talk about blood pressure medications, let's stay with exercise for a bit, because there are new studies in that area. And I think that's absolutely fantastic, because depending on where your blood pressure falls, you can now draw recommendations. That means people with normal blood pressure, around 130/85 or lower, have the best results according to the latest evaluations. With isometric strength training, which means your muscles are not moved but statically tensed, like in a plank, these people with normal blood pressure see the best blood pressure lowering effect. People who are already over 130, around 130 to 140, get the best effect from doing so-called dynamic strength training, like push-ups or squats. And those with higher blood pressure, over 140, over 90, benefit the most from endurance training. I find these new insights very, very interesting. It's important that when you do strength training, you don't hold your breath or strain. That's very, very important. And it's also crucial that you do it almost every other day, because similar to blood pressure medication, the effect of this exercise only lasts for a certain period. Which exercise or sport is recommended to lower blood pressure? First of all, the activity you enjoy, the sport you might know from before, that you find fun, that you can do without shortness of breath, without chest pain, and without pain, and that fits into your daily routine. And I was probably in the same dilemma as you, and I'll tell you in a moment how I incorporated sports and exercise into my daily routine as a doctor and managed to implement it, and many patients are already copying this. Which sports are good? If you have relatively low blood pressure, around 130 or 140, you can really do walking, jogging, cross-country skiing, cycling, swimming. All these endurance sports are very, very good. You can also do dynamic strength training, a bit of squats, push-ups, some weightlifting. Just make sure not to strain too much. Or sports and games with low impact, like table tennis, golf, billiards, gymnastics, all of that is no problem. Sports that are somewhat suitable when blood pressure is already elevated include dancing, horseback riding, bowling, volleyball, and tennis, especially if your levels are around 140, 150, and medication isn't fully controlling it. Activities like rowing or skiing should be avoided as they involve more intense exertion. High blood pressure makes athletics like sprinting, jumping, throwing techniques, and weightlifting, serious bodybuilding, strength training, or ice hockey off limits. High stress activities like sailing, diving, and windsurfing, where you might need to hold your breath, are also unsuitable. How often should we exercise? The foundation is endurance training, like brisk walking without gasping for air. It should be around 30 minutes, ideally 5 days a week. That would be the best. And you can, of course, split these 30 minutes into 10 or 15-minute segments at first. You can also start slowly with 2 5-minute sessions, 10 minutes or 2 15-minute sessions. In any case, aim for 30 minutes of basic training, and then you should be physically active every other day. You should do a bit more exercise than just this basic training and mild endurance training, for example. Do few repetitions, maybe 15. Train without holding your breath, just keep a steady rhythm, and this way you can gradually increase your physical activity. I really try to move for 1 hour every day at a very, very fast pace, almost jogging. I'll show you how I do it in a moment. Before COVID, many people used to keep their appointments at the practice. Since COVID, more people need phone appointments. For this purpose, I did the following. I always grouped my phone appointments together during the day. That means I know I'll be on the phone for an hour or 45 minutes. And I got myself a standing desk, which I already had. And now I have a treadmill under this standing desk. That means it's a foldable treadmill. I actually saw it online from another colleague and bought it for the office here. It gets unfolded, the standing desk is raised, and I like it so much that I already get my hour of exercise daily at the office. And I liked it so much that I also bought a slightly more stable treadmill for jogging at home. This has the advantage for me that I'm completely independent of the outside temperature and weather conditions, and I come home from work having already done my minimum exercise. And one last thing to mention, stress is an incredibly significant factor in high blood pressure. Just make sure you create a personal sanctuary that is inviolable. For example, one of my patients with high blood pressure cares for her very, very aggressive husband, and she has literally created her own sanctuary. She rented a small room in the same town for very, very little money, where she can retreat and truly find herself, receive friends, and be away from her husband for a while. Speaking of friends, social contacts or meditation can also help reduce stress. My personal escape is the sauna. There are even studies showing that combined with heat, it's really easy to unwind there. It has to be something that completely captivates you, distracts you, and takes you out of your daily routine and thoughts, and that could also be a game against a chess computer. Let's talk about blood pressure medications. Often these 4 classes of drugs, which we'll discuss shortly, are combined. Usually you start slowly with the classic water pill. And before we go through the individual medications, let's look at the most common mistakes. People often confuse blood pressure pills with painkillers. This means they use blood pressure pills like painkillers, thinking, oh, my blood pressure is a bit high today, I'll take a bit more, and then forget about it the next day. This is a very, very common and significant mistake. You really need to take blood pressure pills regularly. Another big mistake is taking them at different times. This implies that you should adhere to a consistent schedule for taking your blood pressure medication daily. Typically, doctors recommend taking these medications in the morning. Nevertheless, recent studies suggest that taking them later in the day or at night could offer significant benefits, especially since nighttime blood pressure poses greater risks. Therefore, consider discussing with your doctor the option of shifting your medication to nighttime if you experience high blood pressure upon waking. Additionally, it is crucial not to miss any doses. In case you forget, consider setting an alarm or using a pill box to ensure you remember to take your blood pressure medication every day. Because blood pressure medications, as mentioned, are not like painkillers. This means we need to take them regularly. The entire hormone balance, water balance, electrolyte balance, and so on, all need to stabilize, and you can't just turn it on and off like a radio, and it's really dangerous if you suddenly stop the medication. This can lead to rebound phenomena causing very dangerous spikes in blood pressure. That's precisely why I emphasized earlier that altering your blood pressure management should be a collaborative effort with your doctor. They possess extensive experience in this area and can highlight any potential challenges. It's crucial not to adjust the dosage independently. It's important to have a discussion about it. Doctor, what steps should I take if I experience dizziness or observe excessively low blood pressure levels in the morning? How should I adjust the tablet then? And don't do it alone or just stop taking it. What are common mistakes here? Patients often don't dare to talk to the doctor about it. They don't want to bother the doctor. You always get the impression that doctors have no time. But it's completely normal with blood pressure management. Just like with adjusting blood sugar lowering medications, things simply change and the hospital dosage isn't the same as at home. Your situation changes, you might gain weight, you might lose weight, so don't be ashamed, feel free to ask, and very, very important is regular blood pressure monitoring. The dosage needs to be understood in relation to how you feel. How do I feel with this dosage? How does it change on stressful days and so on? And do me a favor, check if your blood pressure monitor is still suitable. Because it's not uncommon that the most frequent cause, or one of the most frequent causes when a patient says, I suddenly have high blood pressure, is simply an unsuitable blood pressure monitor. Let's briefly talk about the 4 groups of substances, and these 4 groups, the common ones, can be combined. So the starting point is always the diuretic, the water pill, or the dehydration pill. What's the principle here? These are simply medications that stimulate kidney function to excrete more water. And then we have less water in the vascular system. This naturally lowers blood pressure, increases urine production, and of course the problem here is that we then excrete minerals. A common side effect is that potassium, sodium, magnesium, and so on can become deficient. You simply need to closely monitor these levels with your doctor, and what else can happen? It can be that too much water is lost from the system, leading to dehydration, meaning water is missing and you essentially dry out. The skin folds stay up and don't return elastically. You might notice this if your heart rate increases. The second group of substances is no less well known, the so-called ACE inhibitors. How does that work? It reduces, or the amount of a substance that is produced is reduced. The amount of the so-called aldosterone produced decreases, and this aldosterone leads to sodium and water retention in the kidneys, which then results in increased blood pressure. And if we block that, if we inhibit this mechanism, then the sodium and water are more likely to be excreted again, and not as much sodium and water are reabsorbed in the kidneys. And that essentially leads to a change or reduction in blood pressure. The most significant side effect here is the dreaded ACE inhibitor cough, which is a very strange, dry, irritating cough. People suffer from it for weeks, possibly even months, without realizing it's the blood pressure medication. Another possible issue is that potassium levels can rise very, very high. Then we have the so-called sartans, the angiotensin receptor blockers, which block the angiotensin receptor. This means that when you block this receptor, the vessel constricting effect of the substance angiotensin is less pronounced, leading to the blood vessels dilating and the blood pressure lowering. And here too we have side effects like high potassium, an elevated potassium level, and dizziness can also occur. And calcium channel blockers, the fourth group of drugs that are very, very commonly prescribed, essentially regulate or block the influx of calcium into the muscle cells of the blood vessels. The muscle cells, well, the blood vessels have specific muscle cells, and these can be artificially relaxed so that not as much pressure can build up in the system. And a common side effect here is swelling in the ankles and feet. And if combined with a diuretic, you might have noticed in your family that ankles and feet often swell, and people suffer from these side effects as well as dizziness and headaches. And then we have the beta blockers, which you might also know. These are the heavier medications that lower the heart rate and can also significantly reduce blood pressure. And you should really avoid this medication for as long as possible. Why? It can cause impotence. In short, most people with high blood pressure have control over it. And of course, there are genetic reasons or physical causes that can raise blood pressure. But most people can really come out as heroes, so to speak, and do so much for their blood pressure. Don't see blood pressure medications as enemies, but as help that's available to us. But make sure you work on those 5 points I mentioned. Weight loss, reducing salt intake, quitting nicotine and smoking immediately, giving up alcohol, and of course more exercise, more sports. And I guarantee you, regardless of your blood pressure, if you do this, you'll just feel so much better. And for that alone, this video and the changes you make will have been worth it. I'm glad you'll join us again. As mentioned, the links are below this video. Subscribe to the channel and we'll see each other in the next video. Thanks for watching and see you soon.